Ethicist wants mandatory flu shots for health workers. We should be more afraid of flu than we are of Ebola, according to Arthur L. Kaplan, Ph.D. We are so used to flu deaths. Don't take it seriously, he said. Kaplan is an expert on medical ethics. He thinks healthcare workers should have to get an annual flu shot. The flu kills children and elderly people more than others, and to contract the flu in a hospital, where a person goes because he or she is already ill, is especially dangerous. Kaplan is the Drs. William F. and Virginia Connolly Mitty Professor of Bioethics and Director of the Division of Medical Ethics at NYU Langone Medical Center. With a fierce expression, he said of people who won't get a flu shot, "If you choose not to do that, I can sue you if you kill my kid." The flu vaccine is far from perfect, but it is our only real defense against this illness. University of Pittsburgh Medical Center. As of Jan. 17, 56 children had died of flu this season in the U.S. According to the Centers for Disease Control and Prevention, CDC, this year's most dominant strain of flu, H5N1, is more deadly than most. It is also not a good match for this year's vaccine. Those who developed the vaccine did not predict well, and the vaccine is only 25% effective. That is still effective enough to save a life. According to the CDC, it can reduce the severity of the illness even if it is not a perfect match for the primary circulating strain. Infectious disease physician, Amesh Adalja, MD, FACP Senior Associate, Center for Health Security at the University of Pittsburgh Medical Center, who does a lot of work on influenza preparedness, recommends that people get vaccinated, even with this 2015 imperfect vaccine. Adalja said via email he supports Kaplan's proposal of mandatory vaccinations for health workers. The flu vaccine is far from perfect, but it is our only real defense against this illness. Flu vaccination as a condition of employment for healthcare workers is a good means to increase rates of vaccine uptake. Not only do such actions protect healthcare workers from acquiring flu and/or having a severe course, they also protect patients from being infected by their healthcare providers, he wrote. One of the hazardous things about flu is that people are infectious before they feel sick. That means they can be out and about shedding virus and infecting others. If an infected person is a healthcare worker, he could be on the job, caring for people, and infecting them at the same time. Next, read, in a first, U.S. blames Russia for cyber attacks on energy grid. Washington, the Trump administration on Thursday blamed the Russian government for a campaign of cyber attacks stretching back at least 2 years that targeted the U.S. power grid, marking the first time the United States. Read more. A growing chorus objects to Confucius Institutes at American universities. A Massachusetts lawmaker is the latest dissenting voice against the presence of Confucius Institutes on American college campuses. Managed directly and funded by the Chinese regime, Confucius Institutes, CIS, have been criticized by concerned. Read more. Tariffs, Trump's prelude to ending unfair trade practices. President Donald Trump's new tariffs on imported steel and aluminum look like an effort that goes beyond its stated rationale of preserving national security. Tariffs could be the first of a number of. Read more.